Nianze tena. Okay, thank you viewers for taking your time to join. We are here once again this Sunday to bring to you this topic, the low back pain. It's what we are going to look at this day. And we are here with Dr. Atera is here with us. And maybe just let him to introduce himself, his name, maybe to say his name correctly, and then we continue from there. Welcome, Dr.
Thank you very much. Hello, dear viewer. Hello, everyone. I want to take this moment to welcome you to this wonderful show. We'll be able to learn together. My name is Enock Atera. I'll be guiding you through as we study and discuss about lower back pain.
Thank you so much, Dr.
Thank you
for that well-elaborate introduction. I would just like us to pray before we begin. Prayer is very important. So let us pray. Lord of Lords and King of Kings, we thank you, we praise you, and we glorify thy name. As we embark on this topic, give us word to speak unto thy children. And may this learning be an impactful to any child of yours who is going through low back pain, or who knows somebody who is going through low back pain. Be with us in Jesus' name. Amen. Amen. Now, we are here for the low back pain. And I believe that doctor is going to talk about this thing in an impactful way and in a very beautiful way to be enjoyable as we learn. Now, the low back pain, the young generation is asking, is back pain related to stress or mental health? Can back pain be a sign of something serious? Should I rest or stay active if I have a back pain? Now, these are some of the things that the doctor is going to talk about, and we are going to tackle each and every question. The aged are asking, is my back pain due to age or arthritis? The doctor is here to tell us. Do I need an X-ray or an MRI for my back? Can stress or poor sleep cause back pain? Among many other questions that we are here to discuss today. Now, before we begin, take your time, go to YouTube, look for RBF Media TV, subscribe, share, like, comment, and so that they can learn as well. Now, for this first 15 minutes, we want to make it an interesting topic. Now, Dr.
Yes.
We are here about the low back pain.
Absolutely.
Now, kindly, can we ask, or can we start with just a simple question? What is this low back pain?
Very good. Thank you. Low back pain, this is actually a pain that someone experiences at the lower back, which is caused by work with his back for a long time. Poor posture contributes to lower back pain. Diseases, when someone has got diseases like kidney problems, they can be having a pain that will also be at the lower back. Okay. And so many other factors. Okay. So at one point of life, everyone or each one might experience a pain actually at the lower back, depending with the activity. Okay. And most of this is actually caused by the strain to the lower part of the back.
Oh, that is elaborate. Now, Dr. maybe for the people to know what is this low back pain, or where exactly can we experience this? So I would like to stand and then you show us where the pain is mostly felt, because you know we believe that all of our part here is a back. Okay. So can you kindly show us where exactly can we find that back pain? Where exactly?
Very okay. When we speak about back, and we are today measuring on the lower, this is the lumbar region. The back is actually divided from the cervical spine to the thoracic spine. Then we have the lumbar spine and the sacral. Now, when we speak about the places that are prone to having issue of the back pain are actually along this lower part of the back, which is the lumbar region. And this region tends to get pain because it's the region that is mobile. It is the region that is mobile in our human beings, so it's the place where there's a lot of mobility. So when we strain these muscles, in poor posture, in carrying heavy things, they actually end up straining these muscles. They are later causing back issues.
I never knew that these parts are divided, but all I know that this is the movable part. Can we say it is the pivot point?
That is the pivot. Actually, that is where the COG, the center of gravity of an human being, passes through. Yes.
Like your back pain, because if it is the center of the COG, then it becomes very important for us to understand this topic. I believe that during the short time you're going to have for break, maybe in the coming minutes, maybe Steve will show us, as we have that break, the exact thing where Daktari has also told us as well. So Daktari, that is back pain. And that is all what it is, the definition of a back pain. So Daktari, if that is it, now I have a question here. And the question is, why do I have back pain at my age?
Yeah, very true.
And maybe to add on this point, do the back pain have a specific age? Maybe if you are 5 years back pain or any given time. So why do I have back pain at my age?
Most often, I understand that most people that complain about back pain are actually people of an elderly age, due to maybe to wear and tear, due to strenuous activities that have accumulated as they've been working through in their active stage.
Yeah.
But it's very true that even this young generation can also have challenges of lower back pain, and these are as a result of overuse of our back. At times we are so much into sporting activity and we end up straining ourselves. That is number one. At times we young generation are the same people that acquire poor ergonomics. I mean, we have poor postures while we are using our phones. Many of us at times you realize that we use our phones where we are lying down. Maybe you are sleeping and you're using your phone.
Yeah.
So you start straining from your upper neck muscles
No,
to the lower back.
That is very important. So the sitting posture.
Sitting posture.
And also using a phone while sleeping.
Yeah, we're lying.
Now, Daktari, this one is very interesting. I don't know whether we can do it practical here. Or maybe let's say I am here, this floor.
Yes.
And I'm sleeping in my stomach, on my belly.
You're lying on your
And then I'm using my phone.
Very true.
And you can find somebody sleeping with the back.
Backwards.
Yes.
Very true.
So are all of them dangerous or?
They are all going to strain the muscles. And when they strain, then we'll end up with back pain. So what it means that whenever we are using, whenever we are working, whenever we are using our phones, then we should always acquire appropriate sitting posture. It's ideally good to sit while using your phone. Most of the time we encourage that we have good ergonomics. Even the furnitures that you use at the place of work, make sure you are sitting upright while you're using it. Otherwise, you strain your neck and you strain your back, resulting to actually lower back pain. So it's very important we check on that.
So Daktari, there is a question because you've said that when you use your phone while sitting, while sleeping, you can strain the neck.
Neck muscles, of course.
Neck muscles. So how are the neck muscles connected with lumbar or whatever you call it so that it can cause this low back pain? How are they connected?
That's very true. Understanding a concept from the origin to the insertion of the muscles, I mean where the muscles originate to where they're ending. Actually, when you strain, let's understand these muscles originate from the lower back, the lower part of the back as they go upwards to your neck. They are like a relay. And again, these muscles are interconnected. Remember, these muscles attach themselves to the bone, to the framework, so whenever we strain in poor postures, then we are likely to suffer consequence of a pain.
Okay.
Very true.
Understood. Now, there's another question here. Now, viewers, don't forget to ask your questions on your comments. There is a comment box. You can ask a question. You can as well text WhatsApp. The number is 0721 834024. You can ask a question there. You can as well post your question on WhatsApp. Daktari, question here. Can sitting for long hours cause back pain? You're sitting there for long hours.
Very true.
Yeah.
That's a good question. Prolonged sitting again. When someone sits for a very long time, actually everyone is recommended that in every 30 minutes, you should at least stand, stretch, or have a walk. In our day-to-day working at our offices, we highly recommended don't sit for a very long time. What happens when you sit for too long? It's actually you're straining the back again, and the response will be you will create your body muscles will create spasms. They're going to be stiffened. Physical inactivity, when you're physically inactive, again it encourages joints to be stiff. It encourages you to get some muscle spasms, and at the end of the day translating to back pain. So physical inactivity is one of the causes of back pain. So we have to keep moving, we have to keep stretching, and we were made to move.
Yeah.
So prolonged sitting will always affect us.
Okay. Now, Doctor, are you seeing the way I'm sitting?
Very true.
And you are sitting like this. Eh?
Very true.
So is this a problem if I sit like this?
Yeah. First, you're leaning forward.
Yeah.
You're actually straining the neck muscles already because you're not in a neutral position. So when you're sitting, you should always be neutral.
So I should be neutral.
Yeah. Should be neutral, upright, upright, not bossy backwards. Because again, if you do that, that's not a good position.
So the bossy backward is not allowed.
It's not a good position.
Yeah, you feel the
it's
pain.
An awkward posture. It will actually strain, and at the end of the day, you are there complaining, a feeling of a pain at your lower back.
Okay.
So we should avoid all awkward postures. Like when we sit on our sofas, we ensure we have a pillow from behind.
Okay.
When you buy an office chair, ensure it's got a support from below so that your back is well supported. So we need to check on that.
Thank you so much. Doctor, what about when we stand? How should we stand? Kindly you can demonstrate for it, because you see somebody standing like this. Should our standing, and maybe how should we stand? Should we stand straight, or how should we do it?
It's okay. Always what I say, whenever you're standing, you always be upright. An upright
kindly
position.
Show us.
Kindly showing you. Just to show you, when you're upright, you ensure your shoulders are not strained, they're in the neutral position. Your neck again, you're not leaning, but you maintain it very neutral. Your chin straight, and you are focusing or looking forward. So that's an upright posture which we should actually acquire. Okay. That's an anatomical position. That's very true. But leaning backwards or forward, whenever you're walking, then it's a strain which causes a problem.
Then there's also another type of standing where you feel somebody standing like this. You give one leg or one foot more weight than the other. Is that a problem?
It's not a problem.
So that is just okay?
It's just okay.
Okay, thank you. Okay, now Daktari, several times we've come across something that I would like you to talk about.
Very true.
I want to hear from you as a medic. I don't know whether you've had. Somebody can tell you, like some friends say that they feel the pain around their back. And then they ask someone, I'm feeling pain on my back. I don't know what's the problem. And then somebody asks, are you married? And the other person says, no. Then no, now what you need to do, you need a man. So is it really true? Because personally, to me, I don't think it's true. Now, what about when it comes to medical world? Is that true?
Very true. That's a question of being single or married.
Yeah.
While you're single, I think one of the reasons or one of the things that trigger the lower back pain, just as we've looked at, physical inactivity, overuse like in sporting, poor or awkward positions that we acquire. But with this, which we call being single when you're not married, actually it's not one of the causes of anyone getting a lower back pain.
Yeah.
So that is it.
So thank you, viewers. I hope you've heard that. No, there are most people who give wrong advice that you feel that pain, you need a man. You need a man so that you can go with that man. That is not. In fact, somebody once told me that the best therapy for lower back pain is physiotherapy.
Very true.
You'll talk about that when we come to the solutions of these our problems. Now, we've talked about using our phones. Now there's a question here. Can the gym or lifting weight cause our back pain problems? And on top of that, is going to the gym when you feel the lower back pain a solution?
Very true. That's a good question. I'll respond by saying, gym itself, when someone goes there, you go to exercise. But when you go to the gym and you don't get a good instructor, or you don't get to be instructed well, and you get involved to carrying weights in poor lifting techniques, again, this is what will strain your muscles and get you to have back pain. So whenever we carry things with poor techniques, and now this is the thing you really need to check, a concept that we have right techniques, that whenever we carry anything from the ground, we should carry things with the knees and not carry with your back.
You should carry things with
your knees and not your back.
Doctor, can you demonstrate what you're saying?
And let me demonstrate.
Yeah, kindly demonstrate.
What makes the difference?
Yeah.
So most of us is when we want to carry a thing from a ground or heavy
now,
lift.
kindly, you can
heavy
just stand and maybe
assuming
pick this while standing.
Assuming this 10 kg weight, most of us, we always carry things with our back, and this is how you carry with your back. Bending over while lifting an object from the ground is prohibited. When the object is too heavy, it predisposes, it strains. You will feel your lower back muscles carrying. You feel a strain at the back. But the right technique, you should carry things with your knees. Now, the best you go squatting. You get to your weight or whatever luggage or whatever weight, then have it close, then come up with your knees.
Okay.
That is the correct way. So we should carry things. Let our knees carry it, not your back carrying it.
Now, on that point, we're just standing.
Very true.
This one is very crucial. Now, you've said we should carry things using our knees.
Yes.
So you bend the knees first.
Yeah, you bend
so
the
that
knees.
this part is straight.
And again, an upright posture in whatever thing you do is very important. So whenever you're carrying anything, ensure that your back is upright.
Okay.
Yes.
Now, what about now these are clothes. You want to wash.
Very true.
Now, how do you do it?
That's a good question. Again,
or maybe another question as well, you are mopping and you don't have that one, that stick mopper, you just have the
that's very true.
mop. How do you do
Again, I say our concept, you should always maintain an upright posture. Upright posture. So while you are washing, it's good to wash on a sink. I believe there's no sink that was made and was placed under. So
but
you either wash.
There's some people, they don't have the sink.
It's okay. So when you don't have a sink, now you have an option. You either wash while sitting. Okay. So you can sit and bring your basin. The basin is shorter. Just put a load. Ensure it's near you. You can put a stool behind, and they are at your reaching. They are at your hands. So you wash while they are near you, and you rinse and do whatever. So you either sit or stand while doing that activity, while doing your cleaning. Now, you've asked about mopping.
Yeah, mopping.
Mopping, most of us realize that we bend most of the time, or we kneel as we work. By so doing, these poor postures are the ones that get us to back pain. So what the best advice is, if you don't have a mopping stick, then you can kneel.
You kneel
completely kneel. Completely kneel and just try get it done. But the best technique is always have the sticks and you stand while cleaning. And I believe if we do
like
that,
me, I don't know how to use the stick one. With the one with the stick, I don't know for real.
It is the easiest. It's better you start practicing, because at the end of the day, these are the cause, these are the work we have to do. They are our daily cause in our day-to-day life. So it's good we practice this right posture and techniques for our work.
Wow. Okay, Daktari. I hope you have heard that. So we try so much not to bend our back. We should always ensure that our backs are upright. Daktari, another question as well, because this is very important. Now, you are in the farm. Now you're digging your farm. You have your big djembe. Now, how are you going to do it?
That's very good.
Yeah.
Let's realize that anyone doing a farm or digging, it's a form of exercise itself. Number one, what we advised to not to use a small djembe that makes you bent for a long time. I believe many cultures, or you've seen some with different culture setup where you come from. Some use a very long, with a long stick djembe, others with a very small, and they are most of the time bending. So what is recommended is a djembe whose pin is quite tall enough. So while you are digging this, what happens when you kick, then you lift it up. While you dig, as you lift it up, what happens is you are exercising the lower back. You're exercising muscles right to full from your shoulders, from your hands, from your biceps, and even the back. So it's a good exercise because at the end of the day, you build them and you ensure that they are stronger to keep you going.
Oh, that is okay. Now, what should be our sleeping position to avoid the back pain?
Very true. So whenever you're sleeping,
because I've seen some things that when you sleep on this side, there's how you should place your hands. When you sleep with your back, there's how you should place your hands. So what is the best position on?
Now, while we want to be comfortable and free from back pain, maybe I'll answer it also adding to which mattress we should sleep on. Sleeping on a hard or fairly medium density kind of mattress, a mattress that when you sleep on it, it does not sleep. Most of us have mattresses that when you get to it, you are reminding it to sleep. So a mattress should serve you but not to sleep, which means that it should be hard. It should maintain your curvature of the spine. When you're sleeping or when you're lying down, if the mattress is curving inwards, then it curves your spine also. Assuming you are sleeping on the side, that part that is heavier, understand that our body parts, there are some that are heavier than the others. So you realize, depending on which body part, then it
especially
leans,
here and here.
Yeah, that is it. Then you'll be curving inwards. How we sleep, we should acquire a right postures. We should use pillows. Now this is it. If you're sleeping on the side, then ensure you have one pillow at the side of your neck, and the other pillow should be in between your legs. So you use two pillows.
So you use two pillows.
Use two pillows.
You know, I see some these things. Ladies love two pillows. So you mean, you mean I should have one pillow?
Yeah, one pillow
on my head.
On your head, just under your head.
Where I put my head.
Yeah, and the other pillow in between your knees.
Why?
Sideline, for actually comfort and the right posture. Remember, when you're not doing that, your hips are quite big. You're getting that? If you're sleeping on the side, what I mean is we have two legs. We have two legs. So with the two legs, when you've just left this other leg is on top of this other one, in short, you're straining it from the lower part of the back. So what I mean is having a pillow here provides a comfort, provides that alignment. The body alignment is very much okay. So we should always maintain that. Now, lying while facing up, you should have a pillow just under your head, that is at the neck, and the neck supporting the head, and the other pillow under your knees.
So Daktari, I am sleeping at night.
Yes.
Sometimes you turn and you're not waking up. So how will you change the pillow? You've turned, you're backward, now you're facing upward, your pillow is not here. So in that position, can we say that the best now to use is the mattress that do not sleep?
Very true. That's
so it's called, I think it is called the orthopedic, I don't know.
Get an orthopedic mattress, or you just get a mattress that equally does not sleep while you sleep. A mattress does not get inside, a mattress that is worn out, a mattress that is tired, because at the end of the day, you wake up feeling very tired. These are the reasons as to why at times in the morning we wake up feeling very tired.
Thank you. Now, thank you so much, Daktari. Now, those are some of the questions that the old or the aged are asking. Now we are going for a break for around 1 to 2 minutes. And the question here being asked, millennials and the Gen Zs. So we are coming for the for the part of this. So stay tuned and may God be with you. See you in a while. Thank you, viewer. Once again, we are here. God bless you for staying tuned. RBF Media TV is on part 2 of the lower back pain. Dr. welcome back.
Thank you, thank you.
And the viewers, welcome back. Now, we are on another point. Now, Dr. the young have the back pain. The aged are suffering from back pain. Now, there can be a general question. Is our back pain related to stress and mental health, both for the young and for the aged?
Very true. That's a good question again. Can back pain be related to stress? Answering that, very true. Back pain can be also as a result of stress. Number one, you realize whenever somebody is stressed up, there is a lot of what we call muscle tensions. The muscle tension, if you look at the person, muscles from the neck, shoulders, and even the lower back tend to be more contracted, and by so doing, at the end of the day, they result to a strain, they result to someone getting to back pain. That is number one. Number two is pain sensitivity threshold. When one is having stress, these are people who, however small the pain someone might have, this pain, due to the stress, it may end up actually magnifying that pain to be like something very big. It's actually, the pain is actually magnified at the end of the day because of being insensitive to, because of the stress, which actually tends to make him not to manage this, the threshold that is the pain. At the end of the day, you realize that someone is getting to a lower back pain. The other thing is that you also see when somebody is stressed, there is that prolonged a poor posture. When someone has stress, he is less active. So at times he may be sitting in one position, just moody, and by so doing, he may be acquiring an awkward posture. And at the end of the day, that one lessens the physical activity. Somebody is not moving. At the end of the day, you realize your joints become stiff because you are not that active. Yeah. You are not happy at the end of the day. And the last thing I want to say is the inflammations. The fourth thing is that when someone is stressed up, the hormones that are released, these are cortisol hormone, and this hormone actually ends up bringing more inflammation. And you see, when you have inflammation, it brings again pain.
So when you are stressed, some hormones are released.
Yeah, some hormones are released to the bloodstream, to the body, and at the end of the day,
which causes,
they lead to pain.
Okay.
At the end of the day, the pain threshold becomes high.
So stress is a disease.
Stress is a problem which, if well not managed, we may end up with so many symptoms, or we may end up with problems.
You know, Dr. Nowadays, relationships are causing a lot of stress. Many people are passing through stress just because of relational issues.
Very true.
And so we hope that one day we'll talk about how to manage relational. Yeah, it's very important for us to talk about how to manage stress. Now, the age are asking questions, like we found out what is causing stress in these young men. Now, because we have so many questions and we want to go very fast, because we also have to get for solutions in these 15 minutes we have. What is causing my lower back pain as an aged man, as an aged woman?
Very true. And to those who are elderly or aged, you realize that in their lifetime they've been physically active, they've been moving. So most of the time, many of them suffer back pain due to wear and tear.
Yeah.
And these are what we call arthritis. We realize that due to being active or acquiring poor postures, and these are the things that attribute to the same. Very true.
Now, Dr. there's the spinal cord. Now, the spinal cord, if you look at it, is something like it is different bones which are connected. Now, how do we call this thing that connects this thing? Because it's very important for us to know. and suppose it is interfered with, maybe let's say here, if one is interfered with, can it also cause our low back pain?
Very true. Any injury to the spine, and we speak from there are discs, there are vertebral spines, there are spinal processes. It's actually a lot to do. There are many bones that are attached one after another, and they start from this cervical spine, we have the thoracic spine, we have the lumbar spine, and we have the sacral spine. So the sacral is fused, and we move to the lumbar sacral. It is the part of the body which is mobile, and again, because it moves,
is the place that is mobile.
The lumbar region of the back. This is the part that moves. And now moving to the thoracic spine, this spine is fixed again, is immobilized, does not move.
Where is it? Where is that, the thoracic?
The thoracic spine starts from
here.
Yeah, from T12 upwards. Actually, it starts from T1. Actually, when you feel there's
Atera, I think you should show us these things because it is very important.
Now
I can stand. You show us where they
just show
start
how
from.
this back is divided.
Yeah.
We've got just from the neck here, the cervical spine, and this cervical spine starts from around there, runs up to cervical spine, this C7, and from here there's an eminence you can hear. This we are starting with thoracic spine. The thoracic spine, there are 12 of them. There are 12 ending there. From there is the lumbar spine, which is occupying the lower part of the back, which starts from here and ends here. Then here, where we call our tailbone, we have the sacrum, the sacral, which takes around another 5 but fused bones.
Okay.
So with these different bones, the ones that are too mobile, especially region at the neck and the region at the lower back, these are the parts that are prone to having issues, to having pain, to having injuries, because this part are again mobile. Now, if you acquire a poor posture while sitting, while walking, while doing whatever thing you're doing, then they're ending to pains.
What about wrong injection? Can it cause the lower back pain?
Very true. When you're injected in maybe to a wrong muscle, and maybe the injection gets to come close or gets to pierce your nerve, and you understand your nerve, then this is the communication for the body. Nerve these are bundles that actually innervate different muscles of our body, and they take stimuli. They actually take stimuli and bring response to and bring feedback to different muscles. So whenever they are hurt, then you'll have serious pain from that point moving downwards.
Okay.
The nerves also emanate from this lumbar spine. In between those discs, we have the nerves moving from there to the periphery of the body. So if you have a compression again, for a long time, you will end up having problems. You end up having pain, actually radiating to your lower limbs.
Okay. Hey, I see. On the edge, is my back pain due to age or arthritis? I hope you've talked about that. Do I need an X-ray or MRI for my back pain?
Very true. Again, it depends with the nature of the injury. People with mild pain, maybe just due to a strain of a muscle, then we don't need an MRI or an X-ray. What we need, you just come, we physically examine you. If you have no history of trauma, like you got an accident, if you just woke up and you think what activity you did is what that has resulted to your pain that you're having, then we treat you. And this, if you go to a physiotherapy clinic nearby you, we'll be able to help you remove this. At time which the occasions that we need an MRI or an X-ray done, that's when we are highly suspecting that there could be a serious wear and tear, maybe to the elderly. Again, age is a factor. If we think that from how we look at you, we've examined and we've realized that it's not anything physical, then we have to check on and change and request for an X-ray. Okay. In case of trauma, somebody has fallen, somebody has been hit by something, or if the symptoms are again suggesting like you feel some numbness, or you've had a pain that is lasting for more than 6 weeks. You've tried all treatment, but it's not working. A pain that is worsening, even with moving, with activity. These are things that makes you, it's good that you don't just take analgesics, but get to see a doctor to be, get an MRI or an X-ray done so that it is well treated.
Thank you. Next question, I think that one is well elaborated. Can back pain just disappear by itself, or how long can it take to disappear?
Very true, and again, it depends with the cause. If it was just a muscle strain or whatever, if you go down, lie, what we recommend, gentle stretches, gentle activity, you just move small. But if movements excites more pain, you are told to have rest. So back pain due to strain will end up resolving if you get to have enough and adequate rest. When you're at rest, then they always tend to heal with just small physical stretches and strengthening exercises. If you walk about, you also strengthen. Walking, physical activity strengthens our back. So if you see symptoms are worsening, then it's better you see your doctor. And again, by use of analgesics, you just take painkillers for around 3 days. If it was something acute, then it's able to resolve.
Wow, great. Thank you for that. So I see that exercise is one of the remedies for back pain. And we, of course, in the next maybe 5 minutes to time, we're going to talk about the solutions. As we wait, maybe if there's anyone with a question or addition, you are free to bring your questions. Now, Dr. we've talked about that we don't need an MRI when the pain is not that persistent. So that is very important, and we must also see the cause. We can also determine whether it can go away through the cause. So the cause is a factor. Painkillers or just rest for my back pain to go away? Do I need painkillers, or do I need just to rest, or do I need both?
You need both. Let me say, you can observe yourselves again. What I always say, it's good that you are checked. When you say that within your self-care, within either 1 or 2 days, it's still persisting, I always encourage that it's good to see a specialist. And with back pain, it's good you visit a physiotherapist, because these are people who will help examine you and decide the best right intervention to give to you. But do not take painkillers more than 5 days and you still have the symptoms. You're still the same way you were. You'll not be doing justice to yourself.
So, Dr. there are people who their body reacts with painkillers, some.
Very true.
So, what are some of the drugs? Let's say these pharmaceutical drugs. Which ones do you, as doctors, recommend for the pain, for the lower back pain? Or if it's any, and maybe if it's any, and maybe we realize that no, this one works best, and then you find that this person body reacts with that kind of pharmaceutical drug. What exactly should that person do?
Very true. That is why we actually highly discourage people from just walking to a chemist or doing self-prescription. The society we have today, most people love self-prescription. You go just over-the-counter drug, you pick a drug of your own choice. It's good when you get to a doctor, he'll be able to examine, do you have ulcers? He'll be able to give you analgesics that are very friendly. Taking strong painkillers, let's realize that these painkillers are not healthy to our kidneys. So strong painkillers will end up making our kidneys get into problems. So whenever we are using, let the drug you're using be advised with your doctor, so that he underlines, he actually takes your drug history and gives you the best drug of choice.
So, Dr. there must be a viewer who is watching. These drugs, most of them are not good.
Very true.
So is there any other alternative?
So I try, when it comes to holistic management of this musculoskeletal problem, of which we are speaking about, lower back pain, the best intervention, just as I say, and which has worked over the times, if you've just had a muscle strain, you come to a physiotherapy clinic, and what physiotherapist will do is manage the problem. treat the problem from the cause, because you end up realizing that this muscle strain, the pain can be taken away by just massaging. Number two, the pain can just go by you doing exercises. So we incorporate that and get you better. Believe it or not, when you walk to a physiotherapy clinic, you experience yourself. Instead of just living using drugs, we have an alternative that we give you therapy. It's a touch of care that will change the pain to feeling good.
You know, Dr. we know very many people, whenever they feel like they have headache, they have back pain, they run to the chemist, they run to the shop, they just buy medicines. But because what we learned that it's not good for us just to buy drugs anyhow. We should check out first. We should be diagnosed. Thank you so much. Now, I am overweight. Can that one cause back pain or worsen the lower back pain?
Very true again. People that are overweight, actually, most of the time you realize we end up being at times overweight because we are physically inactive. We eat, but we don't actually move, or we have poor eating habits. So at the end of the day, it actually changes even your center of gravity, because again, when you're too much obese, your posture shifts, and again you strain in doing whatever thing you're doing. So it's not good to be overweight, because at the end of the day you'll be straining your muscles, and any strain to the muscles for a long time, it creates a muscle tension. That muscle tension, at the end of the day, you'll end up getting aches. So exercise, physical activity, exercises are very important. They first help us reduce or burn the fats that are in us. Number two, also adapt appropriate and good habits of feeding. We also need to do away with junks. So that we lessen the weight that we have. So,
do I need surgery for chronic back pain? And what is this chronic? Chronic is something that is taking place for so long, right?
That's very true.
So do I need a surgery for that?
Now it depends. For conditions like lumbar stenosis, someone can
Lumbar
be having stenosis.
There
are medical conditions at the end of the day that will warrant one to get maybe a fixation. Maybe they end up into some open reduction and internal fixation. Patients who have got serious wear and tear, severe arthritis, severe forms of arthritis. At times in conditions like lumbar spondylosis, they need to get in, a surgeon gets in and offers the best intervention. The reason is because the pain will be so much. The pain is beyond just the physical treatment. So for various conditions, they need to be fixed. Again, patients with kidney issues, if they don't again seek for treatment, the low back pain can come as a symptom with a patient who has maybe a kidney problem and whatever. And that's why I say whenever you have an issue, better report to hospital with the symptoms. The doctor is able to decide and plan for the best intervention that you will require. For dislocation, some have dislocations, herniated discs, and all these are other conditions that will warrant one to getting to maybe surgery, so that the best treatment and intervention can be done.
Kindly, in very fast, talk about lack of poor sleep. Poor sleep, lack of proper sleep.
Very true. These are our muscles. We use our muscles in our day-to-day activity. So when we have poor sleep or when we don't sleep enough, an average man needs around 6 to 7 hours of sleep. A lady needs around 6 to 8 hours of good sleep. So when you lack good sleep and your muscles, we use our muscles to work, which means that they don't get time to rest. They'll be in fatigue. Fatigue will also be create tension of our muscles. Muscles work best by contracting and relaxing. So imagine they are contracting, they don't want to relax. So they'll be creating spasms at the end of the day. And the spasms will affect you because they'll translate to pain. They'll be leading to pain.
There's several things we can discuss, but time and tides cannot allow us. Now, I just need you to talk about foods or supplements. Are there those which are good for our back pain that can help our lower back pain?
That's very good. When it comes to food, we highly encourage that you eat balanced foods, that you ensure that you have a protein, you have a carbohydrate, you have balanced food, you have vitamins and minerals, and all this food. When you have a balanced diet, then it balances everything. And it's also good to check on, it's not good to be eating a lot of these drug supplements. There's so many outside here are being prescribed with drug supplements of only one side. So it's good to check on holistic food. So ensure that your meal is equally and proportionate of every important vitamin or mineral that you need, which comes through food.
Wow. Dr. Gaze, you will come back again and talk about this thing. Now, just in a minute, can you tell us, plus the viewers, just mention some of the prevention measures that you can take to avoid lower back pain? Of course, you've talked about some. Now, maybe add just some few, because you've talked about the mattress that we should sleep on.
Yes.
You've talked about walking, that is the exercise, right posture, just in a nutshell. Now, how can I avoid? Oh, I just think what you've said, the things that you said, we should now do the opposite of them, right? Like you need to sit properly, you need to sleep properly, you need to exercise, you need to avoid long sittings. Those are some of the prevention measures. Thank you so much, Dr. We are very much blessed to have you, and I guess that we're going to have you again. And viewers, thank you so much for taking your time to watch. Thank you so much for taking your time to log in to RBF to see 1, 2 to 3 things. Now, Dr. before we close, kindly, just tell us where are you coming from, your number, where can we get you in a minute? Welcome.
Thank you very much. Thank you, everyone. Thank you for learning with us. I hereby welcome you to get in touch with us. I'm Enock again from Enomed Rehabilitation Clinics. We offer physiotherapy services, occupational therapy services, and we are hereby to help you get your problem fixed, and with right and good working ergonomics. I believe everyone is going to work in a right way, and let's all be well. So welcome, and my number is 0729 087 914. If you have a question with regards to the presentation, you can ask and we will get you answered. Thank you. Thank you.
Thank you so much. Dr. There is a question here. There is a friend who is watching online. A very, very profound question. The question is, can back pain affect the brain? Is there a relationship between the two to a point of experiencing a seizure?
Very true.
Oh, sorry. Can it cause the back pain affect the brain?
That's a good question. Let's realize the first thing, that the central nervous system is made up of two things. Number one, it's made up of the brain and the spinal cord. The relationship that if you have extreme lower back pain, it might predispose you to things like headaches and many other things. But it's not going to lead you to, or it's not going to cause a seizure in you. So that could be of very different origin or very different problem. But in relation to our brain, then the back pain, if extreme, if you don't treat it, the spasms can be very tight, and the chronicity of the back issue, then you end up maybe having symptoms of like there's a severe headache and many other problems. Very true.
So it's
but there's no direct relationship that it can lead to a seizure.
But it can affect the brain.
It can affect the brain.
So it's very important for us to check our low back pain.
Very true.
Because if it can affect the brain is the engine of the body.
It's very true.
Thank you so much, Sons of Worship and Admiration, for asking that powerful question. God bless you. I guess that is the only question here. Maybe if you get some more next time, we'll answer. God bless you so much, viewers. Time and tides cannot allow us to go any longer than that. God bless you, and always ensure that you are there with us. If you get your time, subscribe, share, comment. We don't take it for granted for you to take your time and your bundles and your Wi-Fi to watch. We really appreciate. We really appreciate for your time. God bless you, Dr. God bless you so much.
Thank you very much.
And I believe that we will visit you one day in your institution that we can learn more.
Welcome.
To the people back on the cameras and the laptops doing the live streaming, we don't take it for granted. God bless you, Menge. God bless you, Steve, for your time. God bless you. We love you so much. Be blessed.